Hi everyone, it's just Jerry checking in from Thailand. Today was a very big day. I just got back from seeing the surgeon Dr Chettawut at the WHI International Hospital. Firstly, what I can say was it is absolutely incredible, beyond surpassed all my expectations. The hotel is completely new. It's looks like a 5-star hotel. We got picked up by the driver in a blacked out, really plush vehicle, and then taken to the hotel, which is just so opulent. It was by far the nicest hospital I've ever seen or ever walked into. It was immaculate, marble everywhere. I was floored, absolutely floored. So that was an amazing start, and as soon as we got the driver pulled up to the front door, someone was there to welcome us. It was like a 5-star treatment, so they walked us through. First of all, I got taken away separately to have a PCR test, so I had that done, and then my sister waited in the lobby, and then we were taken upstairs, and they scanned my passport, and we signed a few forms and stuff, just with the sort of reception and everything. And then we were taken upstairs further to another room, to the surgeon's sort of kind of ward area, I think. And there we sat, and I had my blood, what's it called? Blood pressure checked and all of that. And the nurse took us to a side room, and then we just sat there and talked about all the things that we were going to do pre-surgery, post-surgery, and anything like that. And we went through everything in immaculate detail, and it was also high tech on iPads with pens and everything, and my whole file was there. We went through, yeah, it was absolutely amazing. So after that, the pharmacist then came to see me, and we talked about the medications I was on, and we talked about the medications they were putting me on re-surgery. So I've got a big sort of pre-surgical plan, which I'll talk a little bit more about as it happens, but there's some laxatives, there's some sort of enema, there's the Swift solution, which I think is some sort of laxative cleaning out thing. Just a few, like the day before, I've got clear instructions, which I'll show and talk about a bit later. Also, what have I got here? Some electrolyte sachets. So basically, as of tomorrow, they talked me through this, I will be going onto a liquid only diet, so only sort of clear soups and consommes. Lots of jellies, so I've just been shopping in the supermarket now, picking up lots of jellies. That's basically the only solid-ish thing I can eat, and sort of tea, and yeah, any other electrolyte drinks, and any soft drinks are fine, and fruit juices, but no pulp apparently. So that will be the next few days, and then I'll start this 3-day sort of bowel cleanse the day after. I think tomorrow I start the liquid diet, but I will talk about it as I go. And then, yeah, so they were so informative, and everyone was so friendly and nice, and like, honestly, it was like being treated like a VIP. It was absolutely fantastic. I couldn't have expected anything more. I didn't really know what to expect, because it wasn't clear on the website necessarily what the hotel was like. It felt like a hotel. The hospital was like, because they didn't have many pictures or much information. All I knew is that they had a new hotel, said it again, a new hospital, and it was amazing. So that was that. Then after that, they took me to meet the surgeon. The surgeon came in, and then we went to a side room where he talked to me a little bit about the operation. Well, actually not a little bit, it was quite in detail. And actually his technique and the way he does it, and what my expectations were, and hopefully you can match them. Otherwise, and all the risks and all the possible things that they talk about. So that was that. I'll talk a bit about that in a minute. Following that, we then went and had photos taken. So this is probably the most awkward, embarrassing thing, especially for trans girls that are going to have this surgery. So I still had a dress on, but I had to take up my dress, and then obviously take my underwear down and be photographed down there, and also I had to have photographs done of my Adam's apple, and from different angles, but that was over really quickly. And then he said everything was suitable for surgery, blah blah blah. And then he talked a little bit about his technique, which I knew about, but actually now it makes much more sense to me. So basically, in most UK doctors and other ways in the world use the penile inversion technique, where they basically turn it all inside. Here they do it slightly different. They use the penile inversion tissue to construct the labia majora and minora, I don't know if I'm saying that right. And then they use a scrotal skin graft to make the vaginal canal, and that's with the packing and everything goes in, and that's attached to that outer bit of the vagina, and they obviously construct a clitoris and a clitoral head with the glands at the end of the penis, and then they what was I going to say from there? Oh, they replace the urethra with that all in there. So it's highly technical, but also extremely amazing, actually. So this is why they promise slightly more depth, because they control the amount of depth with the tissue that they're working with, whereas just the normal penile inversion, it depends how much you're working with to begin with. So it's a more guaranteed effect for more deep, more functional vaginal canal. It's just a slightly more guaranteed, but obviously this is subject to change, and everyone is different, and it depends what they're working with when they get inside also, which was explained to me. So that was great. He was really nice, and he said same thing with the tracheal shave, that it's again, they go in and he will try and do as much as he possibly can, but it depends how close to the vocal cords things are, and obviously they don't want to mess around with things too much. So yeah, that was the day, and then they chauffeured us back. No bill was outstanding, apart from if anyone's coming to visit you in hospital, they have to get COVID tests and then pay for their hotel transport, which wasn't included in my original package. But that, I think it sort of came to about 80-90 quid or something altogether for my sister to come and see me in hospital twice. And then she's leaving back to the UK, but they also cover her transfers to and from the hospital in the private chauffeur. So I'll be in hospital 3 or 4 days, I can't remember. So I go in for the operation on Thursday morning at 10 AM, and then I get discharged from the hospital on, I think, Monday morning. So I'm there basically the whole weekend as well, and come out Monday morning, and then I'll go back to the hotel. I'll still at this point be having a catheter, and I will still be having all the packing left inside. The packing is sort of what they use. I don't know exactly what it is, but I think it just keeps everything open, and while you're still all packed up tightly after surgery till you're ready for it to come out. That will then come out at the hotel. There'll be a nurse coming every day for a couple of hours to help, and at the beginning I'm not allowed to do anything. She will, when the packing comes out, she will dilate me, check everything, and teach me how to do it. So yeah, you start with a small dilator once a day, and I think it's about an hour each time, so it's 3 hours a day at the beginning, which is a lot. It then changes to a couple of different dilators, but still 3 times a day, but the times change, and you go up to dilator 4, I believe. They'll give me this pack when I leave hospital, but I haven't got that yet. But the information I'll talk through as and when it comes. But yeah, which will be the next basically 3 months intensively, and then for the next 2 years, and then it will be every once or twice a week after that for the rest of my life. So it's quite intense dilation schedule for quite a long time, actually. So I think a lot of my time is going to be taken shoving things up my pum pum. So yeah, that's that really. I'm trying to think of anything else that I had today to talk about. I'm just, other than blown away, and I couldn't be happier. I think I'm so glad I chose this place, and it honestly feels absolutely luxury. So yeah, it was surpassed my expectations. So I'm very relaxed about the whole thing, and looking forward to the next stage, which is the liquid diet. Also, I'm absolutely going to make the most of being able to eat normal food today. So I bought some sweets, some cute little Hello Kitties. Some more of those. A Toblerone, because it is my #1 chocolate. And these gorgeous bickies that I found, which are like white chocolate Oreos almost, / a custard cream. That's the best way I can describe them, but loving those. So I'm going to stuff my face with delights until the morning when I go on to my jelly and broth. Yum yum. So over and out from another sunny day here in Thailand. Missing everyone at home. Love you all. Bye.